Hello, students. Welcome back to our new chapter. In today's chapter, we are going to learn about the health. What is health and what is the health today? Like, what all problems our health is facing today. So, we are going to learn about the health in this unit. So, when we talk about health, in today's world, like in today's recent years, like from 2019-20, health has become very important, especially the rising new health problems or new diseases. Health has become more important to be taken care of, especially when we talk about 1920, the whole world and the whole year went in coronavirus. So when we talk about health, our health comes first than other things. So we are going to learn about this. What are the health problems? Which disease? We are going to learn about few diseases today. So let's get started. So our first disease is diabetes. So diabetes mellitus, commonly known as diabetes, is a metabolic disease that causes high blood sugar. So diabetes is related to high blood sugar problems. The hormone insulin moves sugar from blood into your cells to be stored or used for energy. That means we all know our body has some blood sugar in it, so when that sugar increases, the problem is known as diabetes. So the insulin is a liquid that helps you to control your sugar level. So if that liquid, the insulin liquid which has sugar in it, increases and that sugar liquid is moved into your cell, then you come across a common problem known as diabetes. With diabetes, your body either does not make enough insulin or can't effectively use the insulin it does make. That means your body produces the insulin, that is the sugar, and if that sugar is not used properly into your body, then you come across the problem called insulin or the diabetes, which is also known as the hormonal insulin. The next common problem is malaria. We all heard about this disease many often times. Malaria is a mosquito-borne infection disease that affects humans and other animals. So that means malaria not only affects the humans but also in animals. Malaria causes symptoms that are typically included like fever, tiredness, vomiting, and headache. That means most of the time it's either fever or vomiting, and also you get the headache. So these are the common symptoms. In severe cases, it can cause yellow skin, coma, or death. That means it is not just that fever or vomiting. If the cases are severe, that means if it is more severe, then it can cause yellow skin, coma, or it can also cause natural death. The next one is the hypertension, that is also known as high blood pressure. Hypertension is another name for high blood pressure. It can lead to severe health complications and increase the risk of your heart disease, stroke, and sometimes to death. That means we have always heard about people having high blood pressure, high blood pressure. So what is this high blood pressure? It is nothing but it is nothing but the hypertension that includes the heart disease, stroke, or sometimes the death. Your blood pressure gets high, and then due to this you can have stroke or heart attack, or that can lead to death. Blood pressure is a force that a person's blood exerts against the wall of their blood vessels. That means blood pressure is a force of the person's blood that flows against the wall of your blood vessels. Next is a very common disease, or we can say common health problem, which is the recent one, that is COVID-19. Coronavirus or COVID-19 is an infection disease caused by the newly discovered coronavirus. So the coronavirus is the new disease that is discovered as coronavirus. It is nothing but a small bacteria. Yes, we have heard it from past 1 year. Most of the people fall sick with COVID-19 will experience mild to moderate symptoms and recover without special treatment. That means there are some cases where there is no special treatment to be given. Like if it is a mild fever of COVID, then people take the home remedies, that is, they quarantine themselves and then have a special ward for it. But if the case or the COVID stage is the last stage, or if it is severe, then it can cause you death. Okay. The next one is the indigestion. It is also called as upset stomach. It's a general term that describes discomfort in your upper abdomen. Indigestion is not a disease, but rather some symptoms you experience, including hormonal abdominal pain and a feeling of fullness soon after you start eating. That means indigestion, that is your upset stomach, and the symptoms are abdominal pain, you have bad stomach pain, and you feel fullness after you just start eating. So here are some paths to improve your health. That means these are the some ways that you can improve your health. The first one is eat healthy. What you eat is closely linked to your health. That means if you don't eat healthy, then you might affect your health. Like some people have a habit of eating everyday junk food, so that can indirectly affect your health. So what you eat is closely related or linked with your health. Get regular exercise. Yes, this is one of the important point. You should get yourself exercise. A small 15 minutes exercise or 10 minutes exercise daily is important to improve your health. Lose weight if you are overweight. Yes, some people are overweight and some people are underweight. So if you are overweight, you should reduce your weight, and if you're underweight, try to gain some weight, but not too much, but according to your BMI, that is body mass index. So according to that, you have to see whether you are overweight or underweight. Protect your skin. Yes, important. Skin plays an important role. If your skin gets affected, it will indirectly affect your health, like you get rashes and allergies, skin allergies. So also protecting your skin is also important part of ways to improve your health. Don't smoke or use tobacco. Yes, this is very important. Do not smoke or use tobacco. That will indirectly affect your lungs and your heart. So you have to quit smoking and the use of tobacco. Then limit how much alcohol you drink. Yes, these 2 points are very important, that do not smoke or use tobacco. And also if you are having habits of drinking alcohol, you should see that slowly you should quit drinking or limit yourself to your alcoholic drink. The next one is drink enough water. Yes, we should drink approximately 6 to 7 liters of water daily. That will keep you hydrated. So drinking water is also one way to improve your health. The next one is sleep for 6 to 8 hours daily. This is also, some people have sleeping problems, so that indirectly affect your health the next day. If you don't sleep properly, you will feel tired or you'll feel a little bit dozy or etc. So sleeping for approximately 6 to 8 hours is very important. And last one is eat slowly. Some people have a habit of eating quickly. They finish their dinner, lunch, or brunch, whatever, they finish it within 5 minutes and they walk off. So eating slowly also helps to improve your health. So slowly when you eat, your body gets that nutrition very slowly, and that nutrition is transferred with the help of your blood to different parts of your body. So when you eat slowly, this process takes place. But when you eat fast, you quickly eat, move, and go wherever you all want to go. So that also plays an important role in your improving your health. So students, in today's video we learned about the health today. What are the health problems, different types of health disease we learned, and the ways to prevent or keep your health a good and fit. So we learned about diabetes, we learned about malaria, we learned about hypertension, that is your blood pressure. Then we learned about indigestion, COVID, etc. Then we learned about different ways of keeping your health good and healthy. So students, I hope you all understood this video very well. Thank you.